There's a lot of great things that are happening in the field of stroke. And about 10 years ago, 15 years ago, a stroke patient was taken in the emergency room, put in the back, kind of left alone. There were no therapies. There was nothing proven to help stroke patients. We've come a long way in the last 15 years, but really there's only 3 proven therapies for acute stroke patients. Only 3, which is strange. You'd think we'd have more than 3 actual approved therapies that have been tested in clinical trials. And they are, number 1, TPA, which is a clot-busting medication given in the emergency room within 3 hours or maybe up to 4.5 hours. Number 2, aspirin. Aspirin given to stroke patients in 48 hours makes a small difference. For every 1,000 patients that get aspirin, 13 benefit, not a great difference. And the third is care in a specialized stroke unit. Those are the only 3 acute stroke intervention. And of those 3, anyone want to guess which one makes the biggest difference? Care in an acute stroke unit. Yes, it makes a huge difference in outcomes. And why? Well, it's because you avoid complications in stroke. And I think that's what we're going to talk about today, complications in the hospitalized stroke patient. And people don't recognize the warning signs of stroke. People don't know what they should do if they have a stroke. They don't know that they should call 911 to get to specialty stroke centers. In Los Angeles County, starting in November of 2009, stroke patients, when they dial 911, get taken preferentially to primary stroke centers rather than community hospital. So we're talking about complications of stroke. We went through a whole bunch of complications in stroke. Caring for the stroke patient in the unit is the most important way to improve outcome. It works better than TPA, it works better than aspirin. And we have a great unit, we take great care of our stroke patients, and we really make a big difference in improving outcomes. And remember, if you can prevent complications of stroke, you can make a huge difference in a patient's life. And our goals in acute stroke care are very often not focused on the stroke they had. It's preventing the next stroke and preventing complications. We're developing new therapies in the field to help treat patients in the first few hours. But for right now, our most effective therapies are preventing of complications. And also keep this in mind. I want to leave you this. A patient who calls 911 is seen by a physician 84 minutes after symptom onset. A patient who calls their personal physician or the hospital itself is seen 270 minutes after stroke symptom onset. So educate people to call 911 so they can be seen by physicians, because time is brain, and every minute the brain loses 1.9 million neurons.